and welcome to yet another interesting episode of Tea Talk, where we'll be discussing latest news, updates, what's buzzing and making noise on social media, as well as all that you need to know to have that ease of living in this beautiful country. As you all know that earlier this month, news across the Sultanate made headlines talking about a month-old child who got infected with COVID-19, raising concerns of the widely spread disease, not just in the adults, but children as well. And for that matter, and to put our mind at ease, we have a very special guest joining us today, Dr. Zaid Al Hinai, who's the Assistant Professor and Consultant for Pediatric Infectious Diseases at Sultan Qaboos University. Thank you so much, Dr. Zaid, for joining us and taking out time. It's a pleasure to have you in person, first of all.
Thank you. It's an honor to be here, and thank you for inviting me.
It's our pleasure. So, Doctor, before we talk about COVID in children, could you tell us in general how you are seeing the situation of COVID in the Sultanate?
Yes. As you know, we're currently experiencing a big wave of infections, which was driven by the Omicron kind of variant, which was a slightly mutated version of the same virus that was able to evade some of the immunity and cause a very big, fast wave of infections around the world. But there are a number of good things regarding this wave. Number one is the infections are now coming down, so we've passed the peak of infections. Even though the numbers are still high, they are on the downward trend. So we expect within about a month or 6 weeks maybe to get to low levels of infection, hopefully. The second good thing, very important in this wave, is that it has proven to us that the immunity against the virus that we've gained from vaccination, but as well from people who've recovered from infection previously, is holding up. It's not holding up very well in preventing the mild infections, but it's holding up very well in preventing severe infection. So in this wave, we've seen much lower rates of hospitalizations, much lower and even lower rates of intensive care and ICU, and lower rates of death. So the mortality has dropped by 80 to 90%.
Wow, that's a huge drop.
Yes, compared to the previous wave. And this is very strong evidence that the vaccination campaign and giving immunity in the community has helped a lot in reducing the danger and severity of this pandemic.
Right. Is it because of people also getting vaccinated, doctor, that the mortality has gone down and, you know, the severity of the infection has gone down? So yes, does the credit goes to the vaccine as well?
Yes, a lot of the credit goes to the vaccine. There's three factors. There's the vaccination, which induced good immunity. The immune system has multiple layers of immunity. So it has antibodies, which even from the vaccine, even though they were designed for a different, for the original version of the virus, they still, what we call cross-react. So they still react even with the mutated virus, albeit at a lower efficacy. So we see breakthrough infection, which is a mild infection, but still there's enough antibody there to drive down the severity of infection. There's also other forms of immunity that develop after vaccination, like cellular immunity. So there's cells that seek out infected cells that contain the virus, and they remove the virus from them. So the vaccine has played a very big role in this decrease in severity. There's also people who recovered from previous infection, and they also have some immunity against the virus. And the best immunity actually has been found in people who have recovered and on top of that got vaccinated.
Right.
They tend to have the strongest type of immunity against the virus and against severe infection. So we do have a good number of that type of immunity in Oman. There's also that the Omicron variant itself is a little bit less prone to cause severe disease, but that contribution to the decreased severity is only about 30% of the story. 70% of the story of why this wave is much less severe has to do with the immune system and immunity that has developed against the virus.
Right. So thank you so much, doctor, for mentioning the main three factors that has led to the decline in COVID cases in the Sultanate and the severity that you're saying. Although the numbers are high, but the severity is not as strong as it was in the previous wave.
Yes, if you look at the epidemiologic curve, it peaked at a higher rate of infection than the previous wave. And that's probably due to that in this wave, the precautions are much less. There's no closures, there's no lockdown, there's no nighttime curfew, there's no stay-at-home orders. So the precautions are much less, people are much more relaxed, but there are still some precautions in place that are helping. So we are seeing more infection than before, but much less hospitalization and death. So it is important, though, to remind everyone that there are mortalities and there are severe infections. So it's not something to be taken lightly. It's not just a common cold. It's actually still more severe than influenza, for example.
Right. Now, talking about COVID-19 among children, you know, we have already had this conversation when it just started, I think, back in 2020, 2019, when we had an interview close to that time. And we were just talking about how COVID is slowly making its way in children.
Yes.
Now, from that point of time, doctor, how do you see COVID among children?
Well, we've seen a lot more spread in children in this wave in particular. If we look at hospitalizations, we're talking about 5 times more hospitalizations among children in this wave compared to previous waves. So in numbers, for example, at Sultan Qaboos University Hospital, we used to have about maybe 2 to 3 children hospitalized with COVID in previous waves, so very small number. Now we're talking about 18 to 20. And so we've had to open a special ward just for children, and it's filled up. So there is a lot more infection and hospitalizations among children in this wave. However, the severity has not increased. It's just the number of cases has increased. So still we're seeing very good recovery rates and very rarely for a child to die from COVID. Most of the children do very well and recover very well from the illness, although it is true that some of them end up requiring hospitalization.
Right. Now, when we're talking about COVID in children, doctor, is there any specific age that you're seeing COVID more spreading in that particular age group than the others?
Yeah, I mean, it's spreading in all ages. The age group maybe that is most susceptible to hospitalization are the young infants, so under 4 years of age, especially under 1 year of age. So we do like to have them shielded as much as possible from infection.
Right. And I remember that, doctor, when previously I interviewed you, we had this conversation and you mentioned something about multi-system inflammatory syndrome among children.
Yes.
Can you just refresh that for our viewers, and is it still happening? Are you seeing cases in the Sultanate?
Yeah, so this was a very interesting syndrome that was noticed in children in Europe about 1 month after the peak of the first wave of COVID in Europe. So it is a dangerous syndrome where after about 2 to 4 weeks from contracting COVID, some children, about 1 in 3,000, so not all of them, a small percentage, will develop this syndrome. And it involves typically severe abdominal pain, diarrhea, and then it can also cause what we call myocarditis, which is the inflammation of the heart muscle. And that's the most dangerous part of it. So we did see a number of those cases in Oman last year. However, since the vaccination campaign, we haven't seen a lot. We're still on the lookout for it with this wave of Omicron, and if there are cases, we typically tend to see them 3 to 4 weeks after the cases in the general population have peaked. So we might still see some cases, but it does seem so far to be not as much as we've seen before. So it might be that the Omicron variant doesn't cause MIS-C as much, but I think it's still early to tell. So we're on the lookout to see if we see any cases of MISC.
Right. And doctor, what are exactly the symptoms that you're saying that when you say you're looking out for those particular symptoms?
Yes.
And for parents to understand those symptoms, what exactly are those?
Excellent. Yeah, so they typically are persistent fever. This is a high-grade fever that keeps coming back or just is continuous. And then they will also, the children typically have a lot of abdominal pain or diarrhea. And typically it will happen about 2 to 3 weeks after the child has been exposed to the virus. And then the more severe symptoms would be also the tiredness, always not being able to get up or always being in bed. And also there are some other symptoms to watch out for, like redness of the eyes and the tongue and the rash and swollen lymph nodes. So, if a parent notices a persistent fever and kind of their child looking more sick than usual, it's good to see a doctor and also mention to the doctor if there had been some COVID cases in the family 2 to 3 weeks before, 4 weeks before, to mention that to the doctor so they can be alerted to the possibility of MISC.
Right. So this was MISC, doctor. What about any other complications or side effects that children get after being infected or exposed to COVID? Are you seeing any kind of those side effects?
Yeah, and the recovery rate is pretty good. Some children have respiratory infections like what we call bronchiolitis or croup, so they may have some difficulty breathing. Those are not very common, but they happen occasionally. And so we can treat those in the hospital with supportive care, and typically the child recovers very well. Some children develop diarrhea and they get dehydrated, so they need to get hydration, sometimes in the hospital. Some children also may, after any viral infection, and COVID is included, they may get invasive bacterial infections. So some viruses tend to cause disruption to our natural barriers of immunity. And so we can see pneumonia or sinusitis or ear infections that could be due to bacteria. So if your child is worsening or having worsening fevers, then they need to be seen by a doctor to determine if there's something else going on as well. But in general, children do very well. They recover nicely, and we don't want anybody to get infected. But if the child does get infected, there's no need to panic. They do tend to recover very nicely.
Right. Now, doctor, if I'm not wrong, the vaccines have been introduced among the children in the Sultanate too, and now children aged 12 plus can now receive the doses here. Yeah. How do you see that implementation in the Sultanate, and what about those who are getting vaccinated?
Yeah, I think for 12 and above, it was made almost mandatory, so for the purpose of school. So we have very good vaccination rates in the 12 and above group. However, we don't yet have the vaccine for the age group 5 to 11. And my understanding is the Minister of Health is working on it, and I do hope that it does arrive. The vaccine for the age group 5 to 11 has actually been very safe. It's even safer in this age group than in the other age groups, like in the young adults. The risk of myocarditis, for example, which is the main concern among teenagers, has actually been found to be maybe 1 in a million, compared to in teenagers 1 in 20,000, which is still very rare and generally mild. So you're talking about a 50-fold less risk. So it's much safer than adults. It's a lower dose. It works very well. I was traveling, so the country where I was traveling to, they had the vaccine available, so we went ahead and gave it to my daughter, who's 5 years old. Okay. And she did very well with it, almost no side effects.
That's amazing.
and she is now asking for the second dose. So, so hopefully we can get her the second dose soon.
Inshallah, once it's rolled out in the Sultanate, so I'm sure that you can also take the advantage of the second dose.
I hope so.
Talking about side effects, doctor, I'm glad you mentioned, coming from, first-hand experience. When we talk about side effects, are you seeing any side effects of vaccine in children? What about the safety?
Yeah, well, most of the side effects are local, so local pain, tenderness. So that my daughter felt. Sometimes there could be a fever and fatigue, and those typically last no more than 1 to 2 days. And those are the most common side effects. So generally, it's very, very safe. The more significant side effects to watch for are extremely rare. So the one side effect that got a lot of press was the myocarditis, which is inflammation of the heart. There's pericarditis, which is inflammation of the heart sits inside a pouch. So that pouch can get inflamed, which is not very dangerous because it doesn't affect the heart, or the heart can get inflamed. However, this side effect in the vaccines has been very rare. It's about 1 in 100,000, and most of those patients recovered very well. Whereas in children under 12, it's even more rare. It's 1 in a million.
Okay.
And so it's very safe, and especially when you consider that the risk of myocarditis, if you get the virus itself unvaccinated, the risk of heart inflammation, myocarditis, and a lot of other complications is much, much higher. So, for example, in children, we talk about MISC has a risk of 1 in 3,000. So, the vaccine is really nothing to be worried about. What we are worried about is the virus. And the vaccine has proven to be an excellent tool to get the danger of the virus down by a lot. So the advice is that don't be afraid of the vaccine. Most of this people talking in social media are not really experts. They're not licensed. They don't know what they're talking about. They don't base their theories, conspiracy theories, imaginations. They're just based on their own imagination. They're not really basing it on solid science. If you get to experts with solid scientific data, it's basically a consensus. Everybody's supportive of the vaccines. There's no controversy. So we want to reassure everybody that don't be afraid of of the vaccine. If you're eligible, go ahead, and it's done very well.
Right. And in your experience, Dr. Zaid, are you seeing parents who are reluctant to get their children vaccinated? Are you coming across that batch?
Well, generally in Oman, thankfully, parents are very very knowledgeable about vaccines, and they're very supportive of it. So in Oman, for example, we typically have 99% vaccination rate in children. So, and that's one of basically pretty much the best vaccination rate that you'll find anywhere in the world. And because of that, we have excellent control over all of the severe childhood illnesses like measles and pertussis and Haemophilus influenza B and pneumococcus and diphtheria and tetanus and varicella, chickenpox. So we've basically eliminated so many diseases, and we've decreased the dangers of so many other diseases. And so people know in Oman how successful the vaccines are, and they're generally very supportive. When it comes particularly to the COVID-19 vaccines, unfortunately, it's been met with this explosion of conspiracy theories and bad news and all kinds of, negative press in the social media, mainly driven by people who are really not knowledgeable,
right,
who are malicious, who are spreading negativity based on just their own imagination without really basing it on real scientific expert opinion. And so, unfortunately, this has really, unfortunately, succeeded in scaring people. And when you talk about COVID, so many people start to cite kind of conspiracy theories and whatnot. And perhaps maybe a lot of people haven't really seen the patients in the hospital, so they haven't seen firsthand what this virus does. We've seen it. We've seen a ward full of people on oxygen, strokes, death, suffering, children, carrying their parents home after. We've seen like such horrible things in the hospital that's why we are so strong and adamant to get people protected and not take this illness lightly. And thankfully, we've seen excellent results now. The pandemic, the danger of the virus has been really cut down about 10 times with the success of the vaccination campaign. So we advise people to really be careful of messages in social media. If you don't just forward anything that comes into your WhatsApp group, even you don't even need to look at everything in the because so many videos.
Yes, especially if it's not coming from an authentic source, doctor.
Exactly, and they're getting savvier. Like these some misinformation groups, right. Like they will make it look like they're in an official studio or make it look like it's some real news network, and it's just a bunch of like conspiracy theories, and just no need to take it seriously. Make sure it is reliable. If it's not reliable, just delete it, because to keep passing it on is really doing a disservice to the society.
Absolutely. Talking about that, doctor, any advice for parents on how to keep their children safe, especially during this time?
Yeah, so generally we don't want children to get infected. We don't want this virus to spread unchecked, so we have to do something. The most important advice is to avoid children who are sick getting in contact with each other. If your child is sick, to keep them home. Don't send them to school. You don't want to infect all the classmates there. Otherwise, wearing masks like the adults do is also helpful, especially in indoor spaces. And also the vaccine, if it becomes available, is also an excellent way to add layers of protection. And in the end, if your child does get infected, I should say that no need to panic, that the recovery rate is usually very good. So no need to be afraid, but it's always good to be careful.
Absolutely. Thank you so much once again, doctor, for joining us today. It was indeed a very informative conversation with you.
You're welcome. Thank you.
Thank you so much. For more interesting videos and updates, keep watching TTV.